Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Hi everyone, this is Gwen Driscoll. I am the Director of Communications at Martin Luther King Jr. Community Hospital in South LA, and it's a beautiful morning. We are here with our Chief Nursing Officer and Chief Operations Officer, Deborah Flores, to talk about our hospital, our response to the COVID-19 crisis, and what you can do to protect your family, your friends, and your community from this terrible outbreak. So I'm going to ask Deborah to introduce herself. Hi, Deborah.
Hi, good morning. How are you?
Good morning.
Hi, it's Deborah Flores, and I serve as the Chief Operations Officer and Chief Nursing Officer here at Martin Luther King Jr. Community Hospital.
Great. So Deborah, I understand you are also the head of our task force on COVID-19 and the hospital's response. Can you talk a little bit about that?
Yes, I have been serving, as, our lead during what we refer to as our pandemic incident related to COVID-19. And keeping in the spirit of Martin Luther King Jr. Community Hospital, I stood up our command center back in early February was when we first got started with our planning towards dealing with COVID-19.
Okay, and for those of us who are not hospital insiders, what is a command center?
So a command center is when there's a major incident in your organization, you get key individuals to fill certain roles. Someone has to take the lead in the incident, so you identify that person. Then you identify someone who handles kind of like your logistical things, like the incidental things that can happen during something like that. It could be anything from the need for supplies, the need for food. So you stand up someone in that role. They serve more as your ops person or your operations person. You also have a physician. And in this situation, it really required the expertise of a physician as well. And you start there, and then you add other team members as needed, like someone in the role that you serve in to be, our PR and marketing person. And those are the folks that work through the incident together, as a team.
Okay, so can you give us a little update about COVID at the hospital and what you're seeing on the floors?
Yes, so in the early stages of this, you probably heard in the media that we were going through this first wave and we were expecting, a peak and then some type of drop off. And we paid close attention to the science behind this, and we did reach a peak back in April. However, the leveling off was not a drop. We started to see some declines, but then we started picking up again at the end of May going into June. And so now we're seeing some of the highest numbers of COVID-19 positive patients per day that we've seen thus far during the incident, kind of consistent with what we're seeing as a nation. Also, as we've continued to be able to increase our testing, we've seen more patients who are called PUIs, or patients who are under investigation. That's what you become when you're able to have a test done and your pending results from that test.
So that's a patient who is suspected of having COVID, but we don't know yet. We're still getting the test. Okay.
Yes.
One of the things we're going to talk about is what women can do to protect their families. And we know that there are a lot of young people out there who think they're not going to get this or it's not going to be that big a deal. Can you talk a little bit about what COVID-19 looks like and how it is a big deal even for young people? What do you see when you're in the hospital?
So in the hospital, what really concerns the team as well as myself is how no matter what age, there's this unpredictable nature, of COVID-19. And once again, out in the community, you probably hear it referred to as the novel coronavirus. That means it's something like we've never seen before. It's new. And so because of that, we state over and over again that even from a symptoms perspective, it may show up differently. And we know that out on the CDC website, there's been changes made throughout the pandemic as to what you can expect in terms of symptoms. And from an age range perspective, I know that when you're young, you feel that you can survive whatever, but there are true cases out there wherein there are young folks who are under 41 who are losing their lives or being severely ill as a result of COVID-19. And the other thing to keep in mind, and this is very important because this is a novel virus, this is the first time we've seen this virus, you don't know what the long-term implications may be. So you may be okay in the short run and recover, but we don't know what the long-term impact can be, on the respiratory system or any other system in the body.
Yeah, and I think one of the things young people really don't get is that coronavirus can wreck your body. And so the recovery is much more than a recovery of your lungs sometimes. It's a recovery of many organs in your whole body.
Yes, when it's so true. There was a woman who was an athlete that was on one of the major networks, and she was sharing how she was a runner and had no pre-existing conditions, and she's still trying to recover, after several months. And along, those lines of making sure that no matter what age, you need to make sure that you do those things that are very important to prevent the spread of this virus. Wearing a mask, washing your hands appropriately for 20 seconds, all 7 surfaces, and making sure that you social distance. So this is being taught in preschool. I have a granddaughter, her name is Ava, and one day Ava was washing her hands, and I noticed that she didn't wash her hands for a full 20 seconds. So I asked her, "Did you wash your hands appropriately?" And she said, "No." And I said, "So what do you need to do?" She said, "Well, I need to go back and wash my hands for 20 seconds or the happy birthday song." So I told her, "Well, you do that." So I heard her in the bathroom and she started singing the happy birthday song and she was washing her hands. Then she sang the song a second time and she was washing her hands. Then she broke into another song and I was like, "You're good now." But to me, it speaks to how no matter what age you are, you can be taught to do the right thing to keep yourself healthy. And that's what it's all about, as we go through this pandemic and also approach the flu season.
Oh, yeah.
That's a whole nother story.
Yeah, my goodness. What role do women have to play in helping to prevent the spread of this virus?
So when I think about women and how, and there's science behind this, we are the ones who make most of the decisions about healthcare. And, we are the pseudo nurses in our homes, whether we have a license to do it, or not. So making sure that we role model the behaviors that we expect of members of our family and even, those who are in our village. We need to make sure that we play the role that we've played, for many years in making sure that the things that are important that we do to prevent this virus, that we're doing those things, and also being mindful of the state of health of those around us and not ignoring any symptom that might be suspect, related to this virus. And something else too, as women, that we have to remember is that we're susceptible as well. So as we're taking care of everyone else, remembering to make sure that we take care of ourselves as well.
What are the warning signs we should be looking for?
So one that we hear of frequently is a fever. So especially, a fever, of unknown origin, it just pops up, you don't know why. The cough, the dry cough. Now, something else related to that, though, is that you're starting to hear of other symptoms as well that might be associated with something else. So that's the part about always know your body and don't ignore anything. So now I'm hearing there could be diarrhea or stomach, upset.
Mm-hmm.
The whole thing about all of a sudden your ability to taste things goes away. And then, sometimes it's just that general feeling of, I just don't feel good. So when those things happen, we need to get it checked out and advise others to do the same.
Right. Yeah, and also this loss of sense of smell, I've also heard.
Yes.
And fatigue. And, as moms, we often feel fatigued, but this is a real fatigue that we need to pay attention to.
For some who I've talked to who have had mild symptoms, they've shared with me how, like I've mentioned earlier, you just didn't quite feel right, just didn't feel good. And so very important. And something else too that has really hit home with me about this virus can impact anyone. Early on, it was actually the end of March. One of my childhood friends died from COVID-19. Mm-hmm. And then 3 days later, his dad passed away as well. Mm-hmm. And it's my understanding that his sister, also had the coronavirus, and his sister, happens to be a nurse. And it was heartbreaking. I finally was able to watch the funeral on Facebook Live about a month and a half or so after they passed away, and it just broke my heart. And there are so many families and friends who are having to deal with this. It's real.
Yeah.
It's
Mm-hmm.
real.
I'm sure you've seen, I've seen it too. We've all seen when we're out in our community, there are a lot of people out there who are still not wearing their masks.
Yes.
What can we say? What can we do about this?
So it goes back to something that I mentioned earlier about being a good role model. And so that's the big one. And making it a habit, the mask wearing has to become a good habit, just like washing our hands and just like social distancing. And once again, I have to go back to my granddaughter. You have to make it fun. She has several masks that she wears, and she picks out what she wants to wear to match her little outfits. And we make it fun now. And even when somebody is in her presence that she's not familiar with, she'll look at me and say, do I need to put on my mask? So if a 5-year-old can do it, I think that we could be responsible adults and make sure, we're doing the same. This has to become the norm.
Right. And the more we wear our masks, there's significant evidence, isn't there, that masks are quite effective?
Oh, yes. Because, you're preventing the spread, of the virus by, having the face cover, on. And there are some nice ones out nowadays. And there are ways to cover, other than wearing a mask. Because I've heard some folks tell me, I can't afford, the mask, because they're thinking about, medical grade mask at times, or, even, what's referred to as a procedure mask. You'll say, well, I can't afford to purchase that. Well, that's okay, because kerchief or scarf tied, appropriately around the mouth and nose can be used. Also, there's some neat little sleeve collars that I'm seeing folks make, or it's something else that you can buy, but you can make it by just taking some fabric, one seam, and putting that around your neck and then pulling, that up, over your mouth and nose. So there are ways to be creative and at a low cost.
Deborah, we're talking about this because, of course, it's really important for women who are the deciders and the caretakers of their families to stay healthy. And we obviously want our community to stay healthy.
Yes.
But there's another important reason why we're really asking the public to wear their masks and wash their hands and do social distancing. And that has to do with hospitals and our ability to respond if the numbers keep rising. Can you talk a little bit about that?
Yes. So because we are working hard to be proactive, I want to tell you the things that hospitals have to do, what we have to do at Martin Luther King Jr. Community Hospital. And it takes a lot of energy, and it really stresses the healthcare system to anticipate needing more beds for patients who may come in who require hospitalization, or for patients who show up in our emergency department. We're having to reconfigure our nursing units. We need additional staff, additional resources to be able to take care, of those who have the virus. And all of that, it costs money. And it's money right now that our nation is really struggling to be able, to have, so that we can deploy resources out to the community. So for an example, when you look at the state of California was really in a budget crunch, one that could have impacted our hospital, at one point in time. And so this pull and drain on the healthcare system impacts us in more ways than just healthcare. It's the resources, the services that our government supplies that gets taxed, wherein we have to take these resources and redeploy them to take care of those who are sick. And when it's something that you can prevent, that's the thing that we have to keep in mind. What can I do to make this a healthier neighborhood, to make this a healthier county, to make this a healthier state, to make this a healthier nation? And we all can play a part in it by taking a few simple steps.
Well, we also want to make sure that if we do get sick, that there's the equipment and the resources to help us recover. And if we get too many people in the ED, that's going to become a problem. I think that's the big fear, that our hospitals will become overwhelmed if people continue to get infected, correct?
Yes, indeed. And I'm originally from New York, and at the height of the pandemic in New York, it was heartbreaking to see the city that I grew up in change, and the way it did. There were hospitals that I did internships at that I watched on TV, how they had to get trucks available, refrigerated trucks, because the morgues were overrun, or having to get the military support to be able to care for patients and families. Just unbelievable the impact that high numbers can have on taxing our health system. And the other thing to keep in mind is that this has been going on for a while now. And we stressed how this is a marathon. It's not a quick little race, but even marathon runners at some point wear down, and they need to replenish and rejuvenate. And so the stress on the system, when we continue to have an influx of patients, it could be detrimental.
Yeah. So really, on behalf of all our healthcare workers, please wear your masks and
Yes.
wash your hands, observe
Yes.
social distancing, all that good stuff.
Yes.
That being said, I do want to stress that Martin Luther King Jr. Community Hospital is in good shape right now. We have adequate supplies, personal protective equipment, which was a concern at the beginning of this. We are not yet overwhelmed, and with the help of our community, we will not get there. And we have excellent people like you in charge, Deborah, to keep things organized and going. And I think this is just a part of the hospital's overall story of excellence. And I wonder if you could talk a little bit about this hospital. It's a new hospital. We're often confused with a county hospital that closed more than a decade ago. But we are a completely new hospital. And I wonder if you could talk a little bit about Martin Luther King Jr.
I am so proud of our hospital and our team. From the time that, I came on board, I can feel the passion and compassion that the members of our team have for the community. And I'm talking about from the person who cleans a room to the person who's a registered nurse to our medical staff. The commitment is there and the commitment is strong. And when I talk to different members, of our community about how we're dealing with COVID, I always say the way we always deal with the health of our community. We face it head on, we face it with innovation, we face it with energy and resources and talent and a can-do spirit. And all of that has played out well during this pandemic. And something else that I was just overwhelmed by was the outpouring of community support. Yeah. And we are all so thankful for it. It meant so much. All the food and masks and donations of gowns, and I could just go on and on about all of the support that was given to our hospital. So to be able to give and receive, it's just a wonderful thing. And I believe that our community, our state, and our nation are very fortunate to have a hospital like ours that rose out of the closing of another hospital and is doing such an exceptional job, even through this, Gwen. For us to be able to be recognized for our work with sepsis, and the best way to describe sepsis is like a really severe infection. We have some of the best results in the country, and our hospital is being recognized for the work that's been done by our multidisciplinary team towards dealing through sepsis, which is a health crisis when someone has sepsis. So there's a lot of great things going on at our hospital, and it will continue.
Yes, and in a way, we've only been around 5 years. Not a lot of time, but in 5 years, we've won awards for patient safety, patient satisfaction. We are one of the most technologically advanced hospitals in the nation.
Yes.
A lot of stuff people might not know about Martin Luther King, but it comes down to a commitment from leadership from the very beginning to excellence.
Yes.
Can you talk a little bit about that?
Yes. Once again, as I mentioned earlier, the whole thing around excellence, it starts with each and every individual. And that's what I see when I'm out and I'm rounding on the units and throughout the hospital. Everyone gets it. And it's all, the members of the team. And something else related to excellence is that we're a learning organization. I've set up a daily huddle. And during that daily huddle,
What's a huddle? Talk about what a huddle is.
The daily huddle is, right now it's a dial-in, but when we get through COVID and this pandemic, we'll be face-to-face. But right now, it's a dial-in number, and we have over 70 members of our team, including medical staff and leaders within the organization. And it's a way of keeping the team updated. But a part of the huddle involves my asking for a safety story or a lessons learned story. And so stories are told, and we're learning by storying around, which there's a great book related to that. And the stories are becoming richer and richer, as we experience more and more through this pandemic. So our desire is to always be in a learning mode. And that's a way to kind of keep us on track there.
Okay, good. Yeah, I've noticed that, but I'm okay. All right, I want to get back to the topic of COVID and ask you some hypothetical questions for the moms, the grandmas, the aunties, the sisters who are out there who are often so influential in their families. So Deborah, I was at a park with my 7-year-old son fairly recently, and I saw a bunch of teenage guys playing basketball without masks. Now, I understand it was hot, they were sweaty, and they probably didn't want to wear a mask. But as a mother, I wanted to walk up to them and lecture them on how they should be wearing a mask. What can a mom say to her teenage boy who maybe doesn't want to listen about safety during this time?
The first thing that comes to mind for me is I was talking to my daughter, and she was telling me that she really wanted, she said, I'll state it the way she stated it to me. She said, Mommy, she said, I really want you and Dad to be safe. She said, do whatever you can do to be safe, because if I would lose you guys, I would die. And I thought about what she said, and my response to her is, well, I need you to make sure that you're wearing your mask and you're doing the right things, because you could actually transmit the virus to me and your dad. So I need you to make sure that you're doing the right thing and you're keeping yourself safe so that you could keep us safe. And I think that's a good conversation to have, with, our young folks. Let them know that if you love me and you care about me, you care about auntie and grandma, then do the right thing to make sure that you keep us safe. And you do that by keeping yourself safe. Also, there's another way as well, Gwen, and it involves the church. Now, I mentioned I'm originally from New York, but moved to Virginia, and that's where I spent most of my career before coming out to California. And our pastor in Virginia has a very active healthcare ministry. And what he's been doing as the pastor of the church, and it has several thousand members, is speaking to the importance, of proper hand hygiene, wearing a mask, and social distancing. And he also does like an once a week check-in with members of the congregation, and continues to push and talk about it. And so the more we talk about it in whatever area we can, if you have a coach, someone in your family who's a coach, talk with the coach. If he coaches basketball, coaches football, or whatever, sport, to reinforce it, with the young athletes. Whatever method, means, or way we can, we need to make sure we do that.
Okay, so we need our community leaders to step up too.
Yeah.
But I think what some people don't know is that most people play a leadership role in some way. You're a leader in your own family.
Yeah.
And so you need to model the behavior. Let's talk about something, at the beginning of this, a lot of people were good. They stayed home. But then as time went on, it became hard. It's hard to be away from your friends and family, from your grandparents, and people started to go out more. Is there a way to safely visit with your extended family and friends? Can you talk about that?
Yes, because I was already missing, my friends from the East Coast. And sometimes we forget about the ways that we can see a face and stay connected. Forget that you can go ahead and do a Zoom call, or use Teams, or use FaceTime with your friends and family. And of course, a way to still get those warm fuzzies and get real creative with it. I have a cousin who lives in Maryland, and she talked with me about cooking a meal together. And at first I was kind of, but then I thought about it. I said, that could be fun. And she does vegan cooking, or vegetarian. So she wanted to introduce me to a meal that she enjoyed. And so you can have some fun with it. I am not.
You mean you did the cooking class virtually by telephone?
Yes.
Okay.
And something else that I have friends who don't drink, who talk about doing mocktails. You can do a mocktail hour, or you can do a healthy smoothie hour, because you can squeeze some nutrition, in there. Other fun things you can do to feel connected is you can do a creative mask hour or half hour. You could do a Zoomathon. You can do virtual exercising. There's lots of things that we can do to get really creative so that you still feel, that connection. And I'm going to even think about that myself, of ways to do some things more creatively. I have another group of friends that we've gotten together weekly to do meditation and visualization. And so there are ways to do it. You've seen some of the creative things in the media to celebrate birthdays. I know some members of my church who turned 90, and there was some really creative things that their family did to celebrate their birthdays virtually. And driving by, in a car and honking, the horn to celebrate somebody's birthday, or leaving, gifts, at someone's doorsteps. And there's just so many things that we can do to be connected during this time, which is very important. So we got to figure out how to get even more creative.
Is there a safe way to socialize in person right now?
Yes, there are safe ways to socialize in person. And the main thing is doing the social distancing and wearing the mask in the presence of your friend or loved one. I'm getting ready to test that. One of my friends is visiting from Virginia, and I haven't seen her in over a year. And she wants to meet, and we said that we'll probably meet on the beach, and I'll make sure, that, we have our mask and that we socially distance appropriately. And I guess now that's become the second best thing in terms of being able to connect with those that we care about.
And of course, what I've heard is that it's good if you have to socialize with someone in person, do it outside. Do it in a place with good air circulation.
Yes.
Keep 6 feet apart. If you're going to share food, do not share utensils.
Yes.
If you're going to do a buffet, don't let people serve themselves. You serve them, so only one person handles the utensils.
And it's the amount of contact with the food. Yeah, I think, and there are some things that we take for granted in terms of beautiful parks and beaches, as long as we're able to keep them open. If we do what we're supposed to do and get these numbers down, we'll be able to enjoy, the beauty of nature all around us by being, outdoors.
Deborah, some people say to me, I find masks so uncomfortable and I can't breathe very well. And I always say to them, if you don't like that, wait till you're on a ventilator. Yes. So let's talk about the cost and benefits of wearing a mask.
Oh yes, keeping yourself well. Just keeping yourself well. No one, wants to end up in an emergency department and being admitted to a nursing unit, and then all of a sudden you can't breathe. And I have never experienced any type of severe respiratory event, but folks have described it to me. And just imagine not being able to take a breath, something that we take for granted. And then next thing you know, someone's having to put a tube down, which is how we, refer, to it, and inject medication that paralyzes, your throat so the tube easily, goes down, and then having to have a machine breathe for you. You've probably seen it on television. It's worse in real life. That is not something that you want to experience. And then the side effects from all of that, because there's something that we're doing to help, our patients recover more quickly, called proning. And it's when you take someone and you put them on their face, but then there's pressure that's on the face from that's very uncomfortable. So this is very serious. I just have to keep restating that. It's serious if you get it. It's serious to recover. And in some instances, the recovery period can be long, can be very lengthy.
Months in some cases.
Yes.
Yeah. All right. Well, I want to end on a more positive note that it is possible to do something about this. It is possible not to get sick. It is possible to prevent your friends and your family and your community from getting sick. And an acronym that I like to use is MASK, which stands for M, wear a mask.
Mask. Mm-hmm.
A for antiseptic gel and wipes. Use it if you can't wash your hands.
Mm-hmm.
S, stay 6 feet away. And K, I'm cheating here, but K is for clean, because you want to keep things clean by wiping down high touch surfaces like doorknobs, kitchen counters, any place where people are going to be touching. Is MASK a good acronym? And what else should people take away as our final thought?
Be consistent. Be consistent, make it a habit. Make it a habit. Do not leave without your mask. Do not get close to someone and forget all about social distancing. Just make it a habit. Make it a good habit, just like we put on our seatbelt. Now, grabbing, a mask or some method of covering your nose and mouth, make it just like a seatbelt. You just snap it on. It becomes just a part of what you do, as well as washing your hands appropriately, all the surfaces, including your wrists, and social distancing. Make it a habit.
Great. Deborah, thank you so much for joining us, talking about this really critical topic, and stay safe.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free KJLH.